So, have you ever experienced a sudden, completely unexplained loss of physical intimacy?
Oh, yeah.
And, we wonder if it's just stress or maybe you're just getting older, but then you realize the actual culprit might be sitting right there in your medicine cabinet.
Right. It is honestly one of the most frustrating biological mysteries a person can go through.
Totally.
Because, the very things we take to heal one part of our body can just profoundly and completely quietly alter another part.
Well, welcome to today's deep dive. If you're the kind of person who likes to look under the hood and understand exactly how your body connects all the dots, this is the deep dive for you.
We have a lot to cover.
We really do. We're looking at a fascinating and I think highly under-discussed biological question, which is, can common medications physically alter vaginal sensation and sexual function?
Yeah, it's a huge topic.
Right. And we've got an incredible stack of sources to unpack today. We're pulling from clinical guidelines from the Mayo Clinic, the NHS, pharmacological studies on antidepressants, and some expert clinical FAQs.
It's a really solid foundation.
Yeah. And our mission today is to demystify exactly how everyday medications, from your standard allergy pill to antidepressants, birth control, how they interfere with physical sensitivity.
And more importantly, we're going to uncover the evidence-based medical antidotes to reclaim that sensation.
Yes, the solutions.
Yeah.
But to solve this mystery, where do we even start?
Well, we really have to look at the body as one giant interconnected ecosystem. Like, you can't change the weather in one part of the map without affecting the soil in another.
That makes sense.
And the most profound weather change we can introduce to the body often starts in the brain with antidepressants,
Right.
specifically SSRIs, or selective serotonin reuptake inhibitors.
Okay, the statistics in these clinical guidelines regarding SSRIs are just shocking. They note that up to 80% of women on SSRIs experience sexual side effects.
Yeah, 80%. It's massive.
And breaking that down, it says 83% struggle with physical arousal and 42% struggle to reach orgasm.
Wow.
I mean, why does a medication designed to ease emotional suffering create such profound physical numbness?
It comes down to something we call the serotonin paradox.
Okay, the serotonin paradox, what is that?
So SSRIs work by keeping more serotonin active in your brain's synapses, and serotonin is brilliant at stabilizing mood, right? It acts like a buffer against anxiety and the crushing weight of depression.
Right, which is life-saving.
Absolutely life-saving.
Hmm.
But biochemically, elevated serotonin acts as a direct suppressor of dopamine.
Oh, wow. So as the chemical that makes you feel stable goes up, the chemical responsible for motivation and reward,
And sexual desire.
right, that just gets pushed down.
Exactly. That's the first roadblock.
Yeah.
But the mechanism goes even deeper than just the desire to be intimate. Elevated serotonin also aggressively inhibits this enzyme called nitric oxide synthase.
Nitric oxide synthase. Okay, what is the physical role of that enzyme down in the pelvis?
Well, nitric oxide is basically the chemical messenger that tells your blood vessels to dilate and expand. So when you're becoming physically aroused, your body really needs nitric oxide to open up the vascular floodgates. It sends blood to the genitals, which causes swelling, lubrication,
Oh,
sensitivity.
right, the physical response.
Exactly. So when an SSRI inhibits that enzyme, you are physically clamping down on that blood flow. The nerves are there, but they just aren't getting the vascular support they need.
That's incredible.
It literally dulls the sensation and blocks the physical reflexes required for an orgasm.
I picture it kind of like throwing a thick, heavy-weighted blanket over a sound system.
Oh, that's a good way to look at it.
Yeah, like it successfully muffles the terrible screeching feedback of depression, but it also just completely muffles the crisp high notes of physical pleasure. Like the bass just can't punch through.
That analogy actually maps perfectly onto the psychological side effects as well.
Really?
Yeah. The pharmacological studies in our stack highlight a fascinating link between this physical sexual dysfunction and a psychological state called emotional blunting.
Emotional blunting.
Yeah. There was this one pilot study that specifically looked at women who were successfully in remission from major depressive disorder while taking the SSRI sertraline.
And the researchers used two different diagnostic scales for that study, right? To measure the physical and the emotional in tandem.
They did. They used the Female Sexual Function Index, the FSFI,
Mm.
to measure the physical arousal and sensation.
Mm-hmm.
And then they used the LOX Emotional Intensity Scale, or LEI, to measure general emotional responsiveness in daily life.
Okay. And what did they find?
The correlation was undeniable. The patients who reported the most severe loss of physical sensation in the bedroom, they also reported the highest levels of emotional apathy outside of it.
Wow. So they were experiencing a generalized numbing of pleasure, surprise, and even motivation to socialize.
Exactly. The lack of physical sensation is essentially mirroring a lack of emotional intensity.
Which just proves that this loss of feeling isn't some abstract concept happening, quote unquote, in your head.
No, not at all.
It's a very real physiological cascade originating from the neurotransmitters in your brain.
Right.
So if SSRIs are intercepting the brain's signals before they even travel south, what happens when the brain is sending the right signals, but the physical environment at the destination is altered?
Yeah, that brings us to a completely different mechanism of interference. Fluid management.
Ah, fluid management.
Yeah, we're moving away from brain chemistry and looking at the body's actual plumbing.
Which points a massive spotlight at over-the-counter medications. Like millions of people take antihistamines and
Oh,
decongestants.
for sure. Allergy season rolls around, you take a pill to stop your nose from running.
Right. You take a pill designed to actively dry up the mucous membranes in your nasal passages.
But the medication doesn't have a GPS tracker.
Right.
It circulates systemically through your entire bloodstream. And the body is an interconnected system.
So it dries up everything.
Exactly. That antihistamine will dry up the mucous membranes in the vagina just as aggressively as it dries up your sinuses. It acts like a systemic dehumidifier.
A systemic dehumidifier. That is such a vivid image. And the clinical guidelines explicitly flag older, traditional antihistamines as the absolute worst offenders for this systemic drying effect.
They do. But allergy meds aren't the only ones manipulating the body's fluids. Blood pressure medications, particularly diuretics, operate on a very similar principle.
Because diuretics are literally known as water pills.
Exactly. Their primary job is to lower your blood pressure by forcing your kidneys to flush out salt and excess fluid through your urine.
Okay.
But that systemic loss of fluid leads to a mild, continuous state of systemic dehydration.
And vaginal tissues rely incredibly heavily on hydration, right? To
yeah.
maintain elasticity and moisture.
Oh, hugely. When you drain the water from the system, you end up with profound dryness. And that translates instantly to friction, discomfort, and what patients basically perceive as a total loss of sensation.
There is another blood pressure medication mentioned in the sources, though, beta blockers.
Yes?
And their mechanism is totally different than just flushing out water. They actually block adrenaline.
Right. So beta blockers are designed to slow your heart rate
Right.
and block the effects of adrenaline, which gives an overworked cardiovascular system a chance to rest.
Makes sense for the heart.
It does.
Ah.
However, biological arousal requires a spike in sympathetic nervous system activity. You actually need a burst of physical stress, a spike in adrenaline, and an elevated heart rate to become physically excited.
So by chemically blocking the body's ability to respond to adrenaline, beta blockers dampen the biological ignition required for intimacy.
Exactly. They put out the spark.
I gotta ask, if someone is listening to this and they've been on a daily blood pressure medication for years and they're suddenly recognizing this profound numbness, I mean, the immediate fear is going to be nerve damage.
Oh, absolutely.
Is a medication that cuts off blood flow and adrenaline actually killing the nerve endings down there?
It is a totally valid fear,
Yeah.
but the clinical consensus offers a lot of reassurance here. Direct nerve damage, where the medication actually destroys the nerve fibers themselves, is exceptionally rare in these cases.
Oh, thank goodness.
Yeah. What we are looking at is an indirect effect.
Indirect, meaning the hardware is fine, but the operating environment is broken.
Precisely. Think of a plant in a severe drought. The roots aren't necessarily dead, right? They're just entirely dormant because the soil is bone dry.
Wow.
The reduced blood flow from a beta blocker, the intense dryness from a diuretic or an antihistamine, all of that creates a flat, incredibly uncomfortable environment that effectively mimics the feeling of nerve damage.
So the nerves are intact, but they simply aren't receiving the fluid volume or the vascular pressure they require to transmit pleasurable signals back to the brain.
But they're just asleep.
Okay, so if allergy medications and diuretics are draining the fluid out of the room, what happens when a medication changes the actual concrete the room is built from?
Now you're talking about hormonal alterations, the third major mechanism highlighted in our sources.
Right. We're shifting from systemic fluids to the specific cellular architecture of the vagina.
And the primary driver of architectural change here is hormonal contraception. I mean, the birth control pill is a profound medical achievement, but it works by fundamentally overriding your natural hormone production.
It suppresses natural ovulation by artificially managing estradiol and progestin levels. But from what the sources say, the true culprit for sensation loss isn't just the synthetic hormones.
No, it's not.
It's a liver protein called LHBG. What exactly is SHBG doing?
Okay, so SHBG stands for sex hormone binding globulin.
Sex hormone binding globulin, okay.
When you ingest an oral contraceptive, your liver metabolizes it, right? And it responds by massively ramping up the production of SHBG. You can think of SHBG as millions of tiny molecular sponges circulating in your bloodstream.
Ninjas.
Yeah. Their specific job is to bind to free hormones, and they have an incredibly high affinity for testosterone.
Really?
Yeah, they soak up the free testosterone in your blood and trap it, completely rendering it biologically inactive.
Okay, the immediate question there is, why does a lack of testosterone matter for vaginal sensation? I think we typically associate testosterone exclusively with male biology.
Yeah, that is a very common misconception. Women
Okay.
absolutely require testosterone for healthy sexual function.
They do.
Yes. The tissue at the opening of the vagina, called the vulvar vestibule, is densely packed with androgen receptors. Those are the specific biological locks that only testosterone can open.
Oh, wow.
So when the birth control pill creates this army of SHBG sponges that soak up all the active testosterone, those receptors in the vulvar vestibule are totally starved of the hormone they need to function.
If those receptors are chronically starved, what happens to the physical tissue?
It physically degrades. The tissue can thin out significantly, it loses its elasticity, and it can become hypersensitive in a negative way.
Ouch.
Yeah, it often leads to a medically recognized condition called hormonally mediated vulvodynia.
Hormonally mediated vulvodynia.
Right, which is characterized by provoked burning pain at the entrance of the vagina, driven entirely by this specific pill-induced hormonal deficiency.
The cruel irony of oral contraceptives is just really stark here. I mean, a pill designed to grant the freedom of worry-free, spontaneous intimacy can biologically alter the cellular architecture of your body.
Making that very intimacy physically painful or just entirely numb.
Right. But the clinical data does point out a fascinating exception when it comes to birth control.
It does. The hormonal IUS, or the intrauterine system, often referred to as the hormonal coil.
Right.
While oral birth control pills have to be digested and processed by the liver, which triggers that massive SHBG sponge effect, the IUS delivers a very low dose of progestin locally right inside the uterus.
So it bypasses the liver's extreme reaction completely.
Completely, because the delivery is local rather than systemic, it doesn't dramatically spike SHBG levels, and it doesn't drain the bloodstream of free testosterone.
That's a huge difference.
It is. Some clinical studies even showed that the hormonal coil actually improves sexual function and desire for certain users, likely because they're getting reliable contraception without the systemic hormonal dampening.
Okay, before we move away from the local environment, the sources briefly flagged two other common medications that cause chaos in the pelvic region: antibiotics and steroids.
Ah, yes.
Yeah.
The microbiome disruptors.
Right?
Antibiotics are basically the biological equivalent of a forest fire.
Mhm.
You take them to burn out a severe bacterial infection, but they don't discriminate.
They kill everything.
Yeah, they incinerate the healthy bacteria in your body too,
Yeah.
specifically lactobacilli. And lactobacilli are basically the guardians of the vaginal microbiome. They produce lactic acid, which keeps the environment acidic and hostile to invaders.
So when the lactobacilli are wiped out by the antibiotic, or when a course of steroids artificially suppresses the immune system, the door is kicked wide open for yeast to overgrow.
Exactly. And chronic yeast infections are devastating to local sensation. They cause intense inflammation, microscopic tears in the delicate tissue, and chronic pain.
And the body's natural defense mechanism against pain is to tense up and shut down arousal pathways, which ruins any potential for comfort or pleasure.
Ice.
All right, so we've outlined a pretty massive biological crime scene here.
We really have.
We've got chemical roadblocks in the brain from SSRIs, environmental droughts from allergy and blood pressure meds, architectural changes from the pill, and microbiome destruction from antibiotics.
It sounds bleak.
It does. Tell me we aren't just stuck with this. Let's move into the medical antidotes.
Let's do it. The silver lining of understanding these mechanisms so precisely is that the medical community has actually developed highly targeted workarounds.
Amazing.
We can start with a fascinating behavioral hack that directly targets the SSRI roadblock we discussed at the very beginning.
Right, because you always hear generic advice like, exercise is good for depression, but the pharmacological studies outline a very specific, time-sensitive exercise protocol for overcoming SSRI-induced Numbness.
Yeah, this isn't just general advice. Clinical trials looked specifically at women taking SSRIs who were suffering from severe arousal dysfunction.
And what did they find?
They discovered that engaging in exactly 30 minutes of moderate cardiovascular and strength training exercise immediately prior to sexual activity yielded a statistically significant improvement in genital arousal.
But why does the timing have to be immediate? Like, why can't they just go for a run in the morning?
Because of the sympathetic nervous system.
Yeah.
We talked earlier about how you need a spike in adrenaline to trigger biological arousal, right?
Right.
30 minutes of intense exercise forces the body to release a massive wave of adrenaline and triggers systemic vasodilation, pumping blood aggressively throughout the body.
Oh, I see.
Doing this right before intimacy creates a temporary, intense physiological surge that actually overrides the dampening effect of the elevated serotonin.
It's essentially using a biological adrenaline spike to temporarily bypass a pharmacological roadblock.
Exactly. It's a physiological override code.
Okay, but if a 30-minute cardio circuit right before bed isn't realistic,
Yeah.
what are the pharmacological solutions? Like, if an SSRI is suppressing dopamine, is there a way to medically put the dopamine back?
Yes. And it is a really common strategy. Doctors will often prescribe an adjunctive medication called bupropion.
Bupropion.
Yeah. Bupropion is a completely different class of antidepressant. It specifically acts to boost dopamine and norepinephrine levels in the brain.
Okay.
By adding bupropion on top of the SSRI, you are actively replacing the desire-driving neurotransmitters that the serotonin suppressed.
So you're restoring libido and physical response without sacrificing the mood-stabilizing benefits of the SSRI?
Exactly.
That's brilliant. What about the physical degradation of the tissue, though? If a patient is suffering from that hormonally mediated vulvodynia, the thinning and dryness caused by birth control or even menopause, how do you restore the architecture of the tissue?
This is where local hormonal therapies are incredibly effective. Instead of taking a pill that alters your entire systemic hormone profile, providers use local vaginal estrogen, or a newer therapy called prasterone.
Okay, the clinical guidelines refer to prasterone as a localized DHEA suppository. Let's break that down, because if you're inserting a hormone suppository, aren't you still risking a systemic hormone spike?
Well, that's the brilliance of DHEA. DHEA is basically a precursor hormone. It's an inactive raw material.
Inactive.
Right. When you apply it locally to the vaginal tissue, it just sits there. It only becomes active when the specific cells in the vaginal wall absorb it and convert it internally.
Convert into what?
Into the exact microscopic amounts of intracellular estrogen and testosterone they need to rebuild themselves.
Oh, wow.
Yeah. It never spills out into the general bloodstream. It allows the local tissue to thicken, regain its moisture, and restore its nerve sensitivity without altering your systemic hormone levels at all.
That is incredible. The pharmacological sources also dedicate a significant amount of space to an oral medication called flibanserin.
Right. Flibanserin approaches the problem from a totally different angle. It's an FDA-approved daily medication for premenopausal women suffering from generalized hypoactive sexual desire disorder.
How does it work?
Well, instead of just boosting dopamine like bupropion, flibanserin acts more like a traffic cop in the brain. It specifically targets serotonin receptors.
It's like traffic cop.
Yeah. It turns down the 5-HT2A receptors that inhibit sexual desire while simultaneously stimulating dopamine and norepinephrine pathways.
So it's a highly targeted effort to rebalance the specific neurochemical ratio that drives intimacy.
Exactly.
We've covered pills, precursor hormones, and exercise, but we have to talk about the physical therapies because the technology highlighted in the Women's Health Clinic FAQs sounds almost unbelievable. Fractional CO2 laser therapy.
I know, it sounds intense.
It does. When most people hear the word laser, they think of burning away hair follicles or like reshaping a cornea. How on earth does a laser restore vaginal sensation?
I completely understand this skepticism. Aiming a laser at delicate tissue sounds so counterintuitive. Yeah. But the clinical trials are incredibly robust, and the mechanism actually relies on the body's own healing cascade.
Okay, walk me through it.
A fractional CO2 laser delivers tiny, microscopic columns of thermal energy right into the vaginal wall. It intentionally creates thousands of microscopic injuries, but it leaves the surrounding tissue perfectly intact.
So you're intentionally causing microscopic damage to force the body to repair it.
That's it exactly. Think of it like tilling the soil in a garden. The microscopic thermal injury triggers an aggressive wound healing response.
Okay.
The body rushes fibroblasts to the area, which forces the massive production of new collagen and elastin fibers.
Oh, nice.
And even more importantly, it triggers angiogenesis.
Angiogenesis, which is the creation of entirely new, healthy blood vessels.
Right. The clinical studies show that this process significantly thickens the vaginal lining, restores natural moisture, and dramatically improves dyspareunia, which is the medical term for painful intercourse.
Rebuilding the vascular network from scratch. That's just amazing.
It really is.
Now, looking at all these solutions, there is one major temptation we absolutely have to address. If a listener realizes their daily SSRI or their blood pressure medication is the root cause of their physical numbness, I feel like the immediate instinct is going to be to just take a drug holiday.
Oh, right.
Just skip their dose on Friday and Saturday so the chemicals clear out, allowing for a normal weekend of intimacy.
The clinical guidelines are totally unanimous on this,
Yeah.
and it requires a definitive, hard warning. You cannot safely take a drug holiday from these medications.
Why is a 48-hour pause so dangerous if the goal is just to clear the receptor for a day?
Because of how these medications permanently alter your cellular baseline.
Okay.
When you take an SSRI or a blood pressure medication daily, your body actually downregulates its own natural receptors because it expects the pill to do the work.
Yeah.
So the half-life of these drugs dictates that if you abruptly stop taking them, the chemical clears out, but your natural receptors take weeks to wake back up. You're just left with a massive deficit.
So you aren't just reverting to your normal self.
Not at all. For an SSRI, an abrupt pause triggers severe withdrawal syndrome. You can experience brain zaps, which literally feel like electrical shocks in your head, vertigo, severe nausea, and a rapid, highly dangerous plunge back into acute depression.
And what if you pause a blood pressure medication?
Your blood vessels can aggressively constrict, causing rebound hypertension, which is a severe cardiovascular crisis. Any attempt to lower a dose, taper off, or switch to an alternative medication must be carefully calculated and monitored collaboratively with a physician.
So you cannot simply hack your prescription schedule. The power here lies in taking this specific biological knowledge right into your doctor's office. You can confidently say, my daily medication is altering my local tissue, and I want to look into adjunctive bupropion or local DHEA or an alternative blood pressure class.
That's exactly it. Medication is a modern miracle. It stabilizes our minds, prevents heart attacks, manages chronic disease.
Definitely.
But understanding that your body is an interconnected web really empowers you to demand a better quality of life.
Yeah.
A chemical change in the brain alters pelvic blood flow. A spike in liver proteins fundamentally starves local nerve receptors.
Right.
But the ultimate takeaway from all of this data is that you absolutely do not have to accept the loss of physical sensation as the inevitable price of treating a medical condition. The workarounds are proven, and they are available.
It completely shifts how we view the medicine cabinet. I mean, at the beginning of this deep dive, we talked about broken arms and how much we crave simple, visible diagnoses.
Yeah.
But exploring the incredibly complex, unseen ways that a standard daily allergy pill or a routine blood pressure medication can so profoundly manipulate our physical sensitivity, our emotional intensity, and our fundamental desire to connect with other people,
Yeah.
it just leaves you with a much deeper question.
It really does.
If the everyday chemicals we consume without a second thought have the power to systematically dial down our joy, our motivation, and our physical intimacy, how much of what we consider to be our fixed core personality is actually just a temporary byproduct of whatever is currently sitting in our bloodstream?
Wow. Certainly makes you evaluate the concept of biological identity in a completely new light.
It really does. Well, take care of yourselves and keep asking the right questions.